What is sciatic pain or sciatic nerve pain? Well, it's pain that starts in the lower back and goes down the back of the leg. Now, sometimes that pain can radiate just into the gluteal area. Sometimes it radiates to the thigh. Sometimes it can radiate all the way down to the calf, maybe even the foot. Sometimes it's continuous pain, and sometimes it's broken up, which means it radiates into the thigh, it skips the knee, and goes to the calf and the foot. All of those can mean different things. So really, you need a professional look at you and tell you exactly what's causing it, because what's causing the pain is way more important than the pain itself, because if we know the cause, we can remove the cause. Remove the cause, the pain should go away. So if you're experiencing low back pain, pain radiating down the leg, that could be sciatic pain. And if it is sciatic pain, pay attention very, very carefully, because some of those causes are disc issues. So if a disc is bulging in the lower back, you see the bottom 5 nerves here, L4, L5, S1, S2, and S3 nerves come together and form this big nerve, probably the longest nerve in the body, that goes from the spine all the way down. That nerve helps your brain control everything that happens in your foot, leg, thigh, and hip. All those are controlled by that nerve and branches of that nerve. And it's a big, thick nerve. A muscle wraps around it called the piriformis nerve. If that muscle is tight and tense, that can also press on the sciatic nerve. That's the kind of pain that skips the knee. So if it's a piriformis syndrome, it's sciatic pain, but it's because of a muscle being tight. Now, why would one muscle get tight, not the other? Because you rarely get sciatic pain on both sides. It can happen, but if that's the case, that means there's central canal stenosis, meaning the spinal canal is narrowed and both nerves on both sides of the spine are being compressed. That can be even more serious. It can lead to other issues. Now, if it's on one side, you go, why did piriformis muscle on one side get tighter than the other? Well, sometimes pelvic unleveling can cause that. If the pelvis is uneven by even 4 or 5 millimeters, that can cause the piriformis muscle on the high side to get tight and tense, because your gait changes. Gait is how you step and how you walk. So disc can press on one of those nerves and cause sciatic nerve. Misalignment of the vertebrae can cause an imbalance and interfere with the nerve, cause that nerve pain. Muscle imbalance can cause the same thing. So you're going, well, how do you fix it? Well, depending on the cause, right? If it's a disc bulge, maybe decompression therapy would be what we could do for you. Spinal manipulation or corrective adjustment of the spine, that needs to be based on x-ray. We need to know which bone is misaligned. Correction of that. Leveling the pelvis can change that imbalance as well. So always look for the cause. Hopefully this was helpful to you. If it is, and you know someone who has sciatic pain, share the video. Also subscribe and maybe comment and like the video. I appreciate you.